The National Association of Resident Doctors has directed its members in 91 tertiary health institutions across the country to withdraw their services completely and indefinitely from 12 a.m. midnight on Monday, the 12th of January 2026. Now, they say the directive was due to the federal government's failure to honor a Memorandum of Understanding entered with the association. The association says that the MOU, the form informs the totality of its demands, comprising 19 in number, and they address critical demands bordering on improved welfare, increased salaries, and issues affecting resident doctors' professional practice nationwide. News Central's Aishat Salihu is live to give us details of the issues resulting to the planned strike and the position of the federal government through the Ministry of Health. Aisha, let me just start by asking, what are the resident doctors asking for?
Blessings, I'd say it's nothing new. These are the demands they have always asked for, and this time around they're reiterating and they're targeting this strike action to be a total shutdown of facilities within the healthcare sector, total indefinite and complete strike, and where they say no implementation and no going back. And part of their demand that has always been on the table would be that the reinstatement of the Federal Teaching Hospital Lokoja 5 back to the same facility with full payment of all outstanding salary and arrears, promotion of payment and payment of salary arrears, implementation of the PAT with inclusion of arrears in the 2026 budget, skipping and entry-level issues, specialist allowance, house officers issues, membership certificates, constitution of committees on local practice and work hours regulation, amongst other demands. These are just a few of out of the 19 demands that they have stated on the table, asking the Federal Ministry of Health to attend to these issues. And the doctors are talking tough this time around, saying that until these demands are met holistically, they won't be going back to resume duties at the healthcare centers.
So, Aisha, has there been any response whatsoever from the authorities? And are we looking to even receiving a word from them?
Blessings, I would say just earlier in the week, say on Tuesday, the federal government through the Ministry of Health, I'm talking about the person of the Minister of State for Health, Dr. Aishat, he came out, and then there was a press statement that was released afterwards where he said that the Tinubu administration is dedicated to ensuring that Nigeria's healthcare sector is well taken care of. According to the Minister of State for Health, he said the president has demonstrated this commitment in November 2025 by approving an upward review of professional allowance for health workers, adding nearly 90 billion naira to government expenditure annually. And then he says that the increment covers call duty, shift duty, non-clinical duty, and rural postal allowances, and was reached through joint negotiations involving all health worker groups. But then I would say that the resident doctors are saying that even with the government saying they have done this and this is on the way, they still say that there is more of the government is not really demonstrating what it should demonstrate, which is total and holistic commitment. But from the part of the Ministry of Health, they are saying that it's not about neglect, that the healthcare workers are not neglected, but their demands are being met. But then I think this will give the question of how serious Nigeria is regarding the healthcare sector.
Okay, Aishat, Salihu, thank you so much. Apologies for interrupting you, but because of our time, we have to go. But thank you. That's Aishat Salihu there, giving us the update on the planned National Association of Resident Doctors strike.